In the long term, what brought me to a career in public service was an entire childhood in which my parents did a really good job of conveying to me that one's life is about more than just oneself, and that people really have a responsibility to be part of not only their small community but also a global community. In this sort of medium term, I studied abroad in Bolivia, and while I was there, I worked at a sort of orphanage, community center, health clinic, after-school program. It was kind of everything that anyone needed it to be. I saw how these kids really lacked the resources and lacked the opportunities that I had. And I had grown up being aware of that, but not really seeing it and experiencing it in that kind of powerful way. And it was really, really powerful to me to see that these children, through no fault of their own, lacked any kind of basic health care, dental care. Almost all of these kids had missing teeth, not because they were, getting their grown-up teeth in, but because they lacked any kind of rudimentary dental care. And so it really drove me to find ways to give them the opportunities that I had. And in the very short term, for the last 3 or 4 years, I've worked in advocacy in DC, and I've really seen that there is a lot of ineffective management and ineffective operations in advocacy organizations, in service providing organizations. And I think it's incredibly important that nonprofits be effective in both in their advocacy services and in their, distributing healthcare products or whatever they're doing. So I think part of what drove me to the Kennedy School specifically was understanding that the curriculum here would provide me with a rigorous set of tools that would enable me to be an effective manager. I really want to find an organization that's doing good, important work and make them even more effective and make them even more powerful agents for social change in the world. U.S. international policy around sexual and reproductive health and rights has been an incredibly charged issue and has seen a lot of controversy. And in fact, our policies have changed almost 180 degrees depending on the administration that we're in. People assume that this is an issue that it's going to be really impossible to reach across that divide and bridge that gap. And I think it's actually happening a lot more than people think it is. And it's actually a lot more realistic to think that we can do more of that than people realize. And I think in developing countries, there are already incredible people working across that divide. And I think that if people speak in compassionate ways and if people extend themselves and have empathy, it's very, very easy to connect with people on sort of a human level. For me, the guiding principle is sort of empowerment and recognizing that every person that I'm trying to reach has their own story. So I'm hoping to work for an organization that not only is working to affect global policy and particularly U.S. policy, but is also having a real impact on the ground and is actually, providing condoms or providing healthcare services to, real women in developing countries.